This is Janet Hale with the Rock Island County Health Department. It's 3:30 p.m. on January 7th, 2021. Thank you for joining us. Today we have with us Edward Rivers of the Scott County Health Department and Nita Ludwig of the Rock Island County Health Department. But first, let's start off with some daily numbers. Nita, what do we have in Rock Island County?
So I am happy today to be able to say that we have 0 deaths reported for today in Rock Island County. So our death numbers remain steady. We do have 85 new cases of COVID-19 in our county today, which brings our total to 11,178 cases, and 43 people are currently hospitalized in Rock Island County with COVID-19.
In Scott County today, we have 14,609 cases reported, and 153 people have lost their lives to this virus. As usual, you can obtain more details at coronavirus.iowa.gov.
Thank you, Ed and Nita, for that. Let's start off with some remarks from Nita, please.
Sure. So we've said all through our COVID-19 response that information is changing quickly. We saw a great example of that this week. On Tuesday, we shared the then accurate information regarding the state-phased vaccine plan. And on Wednesday, Governor J.B. Pritzker announced changes to that plan. And this is what we know now, but again, it is subject to change. First, this is what stayed the same. Phase 1A, as outlined in the Illinois Department of Public Health plan, remains that only people who work in healthcare are getting vaccinated in Phase 1A, as well as long-term care residents and staff. We expect this phase to last through January and into February. The Rock Island County Health Department will hold a socially distanced drive-through COVID-19 vaccination clinic, again, for healthcare workers only, from 9 a.m. to 1 p.m. on Tuesday, January 12th, at the Greater Quad City Auto Auction, and that is located at 4015 78th Avenue in Milan. Vaccine supplies at this point are still limited, and we will attempt to keep you informed on our website, richd.org, and our Facebook page with how many doses of vaccine will be available. Because we are a bi-state community, you can receive the vaccine in either the state in which you work or where you live. Only healthcare workers with work badges or a letter outlining their role on their company or clinic's letterhead are eligible to receive the vaccine at this clinic. Rock Island County Health Department leaders expect to have clinics at the auto auction each Tuesday until the residents have an opportunity to take the vaccine through the phased approach. Masks and social distancing requirements will be enforced. In addition, we are working with our final partnership details with some pharmacies in the county to also offer vaccines, as well as community health care to offer weekend clinic hours. More information will be available soon from community health care regarding the weekend clinics. There will be no out-of-pocket cost to receive the COVID-19 vaccination at the Rock Island County Health Department drive-through clinic site. Other providers may charge an administrative fee that could be billed to insurance, Medicare, or Medicaid. This is what changed on Wednesday. When healthcare workers have been vaccinated, we will move to Phase 1B. We will use the same drive-through facility at the Greater Quad City Auto Auction in Milan. But Phase B will now include Illinois residents 65 and older, and that's different from the federal recommendation of 75 and older. So in Illinois, it will be residents 65 and older. Frontline essential workers, defined as those workers who are essential for functioning in society. This is not an exhaustive list, but it includes first responders, fire, law enforcement, 911 workers, security personnel, and school officers. Education, including teachers, principals, student support, student aides, and daycare workers. Food and agriculture, including processing plants, veterinary health, livestock services, and animal care. Manufacturing, which includes industrial production of goods for distribution to retail, wholesale, and other manufacturers. Corrections workers and inmates, jail officers, juvenile facility staff, juvenile facility staff, workers providing in-person support to those and support to inmates. U.S. Postal Service workers, public transport workers, flight crews, bus drivers, train conductors, taxi drivers, paratransit drivers, in-person support, ride-sharing services, grocery store workers, including baggers, cashiers, stockers, pickup, and customer service. Shelters and daycare staff, homeless shelter, women's shelter, adult daycare, drop-in programs, sheltered workshops, and psychosocial rehab. So 1B does cover a lot of people in our county. The Illinois Department of Public Health has yet to set the groups for phases 1A and 1B. We expect phase 1C to include food service staff and other essential workers, but we don't know how Illinois Department of Public Health will define the essential workers yet. And we will certainly tell you when they have done that. As we've said repeatedly, COVID-19 is a rapidly evolving situation. Information for Illinois residents could be different from what is announced for Iowa residents. We will share information as we learn it, and please keep watching through our media partners, our social media pages, our website, and togetherqc.com for further information. Thank you.
Thank you, Nita. Now we'll hear from Ed.
In Scott County, we receive many inquiries from the community every day about how to register to receive the COVID-19 vaccine. We would ask the public to understand that during phase 1A, vaccine in Iowa is only allowed to be administered to healthcare workers and long-term care residents. This is at the direction of the Iowa Infectious Disease Advisory Council. That direction also includes prioritizing those healthcare providers according to their risk of exposure to COVID-19. The COVID-19 clinics that are taking place in Scott County today, tomorrow, and Saturday are for healthcare providers only. They're not open to the public. They've been scheduled by appointment for phase 1A healthcare workers identified as being next in line. We're working directly with healthcare provider offices to schedule their staffs for these clinics. This will continue for additional provider groups as more vaccine becomes available. The establishment of priority groups is due to the limited amount of vaccine available. Advisory councils at the state and federal levels are making extremely difficult decisions in order to best protect the healthcare infrastructure that cares for us all and to help reduce deaths that are disproportionately occurring in long-term care settings. Now, this does not mean that the elderly, persons with underlying health conditions, and our many critical workforce sectors will be left out. They are identified as priority groups, and we expect them to be vaccinated before the general public. We can't tell you when that will happen because those decisions have not been made at the state level in Iowa. We know that the Federal Advisory Committee on Immunization Practices has recommended that states include essential workers and individuals 75 years of age and older in phase 1B. Iowa's advisory committee will decide the order in which they're immunized and if subgroups will be identified. We've also been advised to expect that the supply of vaccine in Scott County will be very low for the next few months. Phase 1B will begin when phase 1A is completed. Additionally, the Iowa Department of Public Health has indicated that all counties in the state will be moving from phase to phase together. While we can't control the supply of vaccine, we can provide information to you about how things are moving in Scott County. Look for updates on news stations and newspapers and on our website and social media pages. We want to share this information with you as much as you want to receive it. So please be patient with us. We have a dedicated staff who are doing their best with lots of moving pieces. We're committed to protecting our community, and we can't do it without you.
Thank you, Ed. So if any member of the media has questions to ask, please put them in the chat box. We did receive a couple of questions early. Nita, what is the current case situation at Tyson?
Thank you. I just looked at that, and they have a total of 206 positive cases to date, and that is since the beginning of the pandemic. So really, it has not had any significant rise or spikes in their positive numbers at Tyson, which is very encouraging.
Okay. And this is a note to Michelle at WVIK who sent the questions early. We are not able to provide the death context that you are seeking at this point, but we will very soon. Are there any other questions?
Hey, Janet, before we conclude, I would just like to clarify for everyone that the date in January that the testing site is at the Taxpayer Center in Moline. I know we put that out a couple times. That is COVID-19 testing only. That is not vaccinations. I just want to be sure that everybody understands that. The vaccination clinic is the one that will be happening at the auto auction for healthcare workers on the 12th.
Okay, thank you. We do have a couple of questions now. Nita, the State Department of Public Health announced the 1 millionth case in Illinois. What comment do you have to that milestone?
Well, that's certainly a frightening number that many people have been infected in our state. Although we do have a large population in Illinois, so that is certainly not unexpected. But what's very encouraging to me, and I think everyone in public health, is that the vaccine is starting to arrive, and that really is a light at the end of the tunnel, or the beginning of the end of the pandemic, if you will. Everyone that I talk to about vaccinations and getting vaccinations is very excited to get them and very hopeful.
And that was a Illinois-based question, but do you have anything to add?
Well, in Scott County and in the state of Iowa, the numbers are lower, but so is our population. I believe Illinois has about 3 or 4 times as many residents as Iowa does. We have a bit over 3 million people, and we have not yet reached the 15,000 case mark. But that is still a significant number, and with deaths at 153 in Scott County alone, that's a very significant toll that the virus is taking.
Thank you. The next question is a little bit more clarification on phase 1B. Ed, I believe that you said that the advisory council was still working on setting priorities for these groups.
Yes, the Iowa Infectious Disease Advisory Committee has not yet announced the phase 1B groups. Also, I believe the question asked whether they'll be prioritized within those groups, and they could be, but at this point, we just don't know.
Nita, have we seen any information from the Illinois Department of Public Health about certain people in groups 1B going before others?
At this point, we don't have really any further information to speak of. We are working with partners like community healthcare and our local pharmacies to be able to help us vaccinate those other phased groups. So there will likely be pretty good options when we get to phase 1B where people can go and obtain their vaccination.
And of course, this is all based upon vaccine availability, which at the local level we don't have control over. It's just what comes into the state and how the state distributes it. So with that in mind, is anyone willing to give an idea of when everyone in the Quad Cities might be vaccinated?
Well, it's all speculation. It just depends on how quickly the vaccine can be produced, whether there's any hiccups in that process, how quick it can be distributed. Early on, the federal government was saying that it may be available to the general public by spring or perhaps summer, but I wouldn't be surprised to see the effort continue throughout 2021.
The other thing that I would just add on to that is there are other vaccine candidates that hopefully will be coming up for emergency use authorization as well. So that can also speed up the process. But yeah, we're looking into the summer, I think, for sure.
Thank you both. That is the end of the questions in our chat. Let's pause for just a couple of seconds here. And then if there are no other questions, we will conclude for today. We expect to be coming to you on Tuesday again. And as both Nita and Ed said, information is moving very quickly on this. So the fastest way that we can get it to you will probably be through our social media channels and our website. But we pledge to give you the information as quickly as we can. So thank you all for joining us, and we will talk to you next week.